Hello all, good evening. This is Nagraj from IIP Digital Media team. So welcome you all for the today's webinar conducted by Indian Association of Physiotherapy, Maharashtra State, Thane District Branch. So today's topic is aquatic therapy, an effective tool in recovery and rehabilitation. Resource person is Dr. Suraj Shukla, and please follow our all social media platforms. And not more wasting time, I'll give over to Dr. Nikita Gatke, ma'am. Thank you.
Good evening, everyone. Welcome to this webinar. We, the Thane district team, welcome you all for this webinar. I would like to hand over the dais to Dr. Pratiksha, who is the host of the evening. Thank you.
Thank you, ma'am. Good evening, everyone. Very warm welcome to all dignitaries and the delegates who took out their valuable time and join us today to be a part of this webinar. This webinar is organized by the Indian Association of Physiotherapists, Maharashtra State, Thane District team. We all know that physiotherapy has been a vital component in recovery and rehabilitation, whereas since last decade, aquatic therapy as a part of physiotherapy has been showing wonderful benefits and is being practiced globally. To have an overview of aquatic therapy, we, the Thane district team, presenting this webinar, Aquatic Therapy, an effective tool in recovery and rehabilitation, by our honorable speaker, Dr. Suraj Shukla. To begin with the event, on behalf of IIP Thane district team, I would like to take this opportunity to thank the IIP central team. Dr. Sanjeev Jha, Central President, Dr. Suresh Babu Reddy, Vice President, Dr. K.M. Annamalai, General Secretary, Dr. Ruchi Varshne, Treasurer, Dr. Joji John, National Head Branch Coordination Committee, Dr. Nehal Shah, Joint Secretary, West Zone, Dr. Sudeep Kale, West Zone CEC, and Dr. Achal Vashi, West Zone CEC. I would now like to warmly welcome the major support system for us district teams, the dignitaries present for the webinar from Maharashtra State team, Dr. Ujjwal Yevle, President, Dr. Amit Gire, Vice President, Dr. Bharti Dave, General Secretary, Dr. Darshana Trivedi, Joint Secretary, Treasurer, Dr. Mansi Mehta, Joint Secretary, the EC members, Dr. Sohan Selkar, Dr. Sanjay Rajhans, Dr. Rahul Deshmukh, Dr. Asmita Moharkar, Dr. Suvarna Ganvir, Dr. Suraj Kanse, Dr. Uttara Mohan, and Dr. Snehal Patel. We welcome you all. I would now like to request Dr. Ujjwal Yevle sir to address the event.
I think Dr. Pratiksha, sir is not available here. We can ask Dr. Bharti ma'am to go ahead.
So now I call upon Dr. Bharti Dave ma'am to speak a few words.
I believe Dr. Bharti has to unmute.
I guess Dr. Bharti ma'am is right now not available. So can we proceed further?
Yes, we
can. Yes. So without any further delay, I would like to start with the event. We welcome our respected speaker, Dr. Suraj Shukla. Dr. Suraj Shukla is pursuing PhD, presently in charge principal of B.R. Nath Pai College of Physiotherapy, Kudal, Sindhudurg, MPT in Neurology, certified aquatic therapist by IATF Switzerland, director and founder member of Cryo Physiotherapy Mumbai, former Assistant Professor at DPO's NEET College of Physiotherapy, Thane, former Director and Lead Aquatic Therapist at United Family Rehabilitation Hospital, Beijing, China, 2018-2020. Now, we request Sir to address the event and cast the light of his knowledge upon us. All yours.
Good evening, everyone. Before starting, I guess Bharti ma'am is already here. So I would request her to do her best wishes and regards and to speak a few words. Bharti ma'am. Hello. Ma'am, Bharti ma'am. Am I audible to everyone? Because I think I'm not audible to Bharti ma'am. Am I okay? Let's start with the presentation. So, thanks a lot. Thank you so much. I think she's not able to unmute herself. We'll wait for a minute. She wears a earphone, then she'll be able to. Hello, ma'am. Bharti ma'am. Good evening, ma'am. Hello. Ma'am, Bharti ma'am, am I audible? There's some technical problem.
Good evening.
Finally. Good evening, ma'am. We were waiting for you to speak a few words. Please, ma'am.
Yes, good evening, everyone. And congratulations to again our Thane team for organizing a wonderful topic. And I know everyone is eagerly waiting to hear the special talk from Dr. Suraj Shukla. And after knowing so many good qualifications and knowledge, vast knowledge on this beautiful topic, even I'm eagerly waiting to hear from you. And wonderful topic, wonderful arrangement. Congratulations to entire team. And yes, we were out and back again on time to attend Dr. Suraj webinar.
Thank you so much.
Without wasting much of everyone's time, who audience are eagerly waiting to hear.
Yeah, sure.
Yes.
Yeah, your wishes were important.
Good luck.
Thank you, ma'am. Yeah. So thanks all. Thank you. I'll just start share screen so that we can. Is my screen visible now? Hello. Is my screen visible? I want someone to unmute and let me know.
Yes.
I'll be starting the presentation. Yeah. So again, a very good evening to all the participants, and thank you, Thane district team, for organizing such a webinar and giving me such a great opportunity. And thank you, Maharashtra state team, for always being a backup and support for our team. So let us start with the topic today. The topic for today's webinar is aquatic therapy and effective tool in recovery and rehabilitation. Aquatic therapy, as a lot of people, when I talk to them about aquatic therapy, and many of the patients, when I tell them that what is aquatic therapy, the patient, they say that it's something to the dearth of their knowledge, they say that it's something in the pool and some movement or some exercise you do it in the pool is aquatic therapy, right? But I would make a point here that aquatic therapy is not just a pool; it is more than a pool. So we will get into the details that what exactly aquatic therapy is. These are a few international organizations which I want you all guys to know, because there are a lot of organizations and institutions and associations who are certifying the physical therapist for aquatic therapy, courses. So we should be aware of the genuine ones, and by which if we want, if someone of us want or inquire that where can we do the certification or where can we get the knowledge about aquatic therapy. So these are the few most important ones of that. IOAPT is International Organization of Aquatic Physical Therapists, which is a subgroup of WCPT, World Confederation of Physiotherapy. IATF is the International Aquatic Therapy Faculty. Aquatic Therapy Faculty is the place in clinical finance. They had their institution, and Johan Lembach and Urs Gamper is the major teachers from there. This is the same faculty from where I have done my international aquatic therapy certification. This is actually located in Switzerland. So AEA, also AEA is Aquatic Exercise Association, and ATRI, Aquatic Therapy Rehabilitation Institute. These are the American institutes and association where they are giving the aquatic therapy certification, and it's based in US. ATNI is the Indian National Network of India, that is Aquatic Therapy Network of India. This ATNI was the first organization or the first institute where I did my basic aquatic therapy certification. Dr. C.G. Prashant is the president of ATNI, and I would like to also mention a point here that I did my master's in SDM, and Dr. C.G. Prashant was my guide. That's where I started my aquatic therapy career. So Aquatic Therapy Network of India, it keeps on organizing aquatic therapy workshops and certification courses. So we'll come to the adaptations of the terms used for aquatic therapy. Earlier, they used to call it as hydrotherapy, hydrostatics, hydrogymnastics, hydrology, water therapy, water therapeutics, water exercises, water rehabilitation. So there were so many different terms about aquatic therapy. But presently, commonly it is the commonly term used for aquatic therapy are aquatic rehabilitation, aquatic therapy, or aquatic physical therapy, because now physical therapists are having this specialization and certification in aquatic therapy. So it is also being termed as aquatic physical therapy now. What is aquatic therapy? So there is a proper definition of aquatic therapy. Aquatic therapy is a set of therapeutic procedure applied in a therapeutic pool by a certified practitioner in bringing about physical, physiological, psychological, and therapeutic changes in an individual. So it is not just a pool or just a exercise in water. The therapeutic procedure should be applied in a therapeutic pool, and it should be done by a certified practitioner. So after doing this, the aim of this aquatic therapy should be bringing about the physical, physiological, psychological, and therapeutic changes in the individual. So this is the advanced aquatic therapy pool. I've just shown this so that we should actually know what is an aquatic therapy pool. I will be showing a few videos in the end of the presentation, so that this actually is the place where I was working in Beijing. It had a movable floor. You can see the floor here. It is at the level of the ground. A person coming to the pool will just walk, and then the floor goes down, and then it goes to this steep, and there is a treadmill inside the pool. There is a parallel bar. There's obstacle courses, and this bike also is can be taken inside. So there is underwater bicycle also. So this is an advanced pool. What is the most all the countries globally have started, most of them have been using aquatic therapy as an adjunct possible rehabilitation. In sports specific rehab, athletic training, aquatic therapy has become one of the must and most effective tools. So it's become an important conventional treatment tool in conservative management of and post-operative rehab of orthopedic conditions. So, as we all know that sports-specific training, a physiotherapist play an important and vital role in training an athlete or a sports individual. But there are a few added benefits of aquatic therapy in training these sports patients. after injury, or also taking in consideration about some conservative management treatment protocol, aquatic therapy has become an important and important treatment tool. We'll be discussing what properties make it more beneficial than compared to the land physiotherapy. Okay. Neurological rehabilitation has also been observed to benefit a lot from the aquatic therapy sessions in treating various symptoms like patient in cases like stroke, Parkinson, ataxia, traumatic brain injury, and spinal cord injury cases. What are the beneficial properties of water? So these four are the major and important beneficial properties, physical properties, which includes buoyancy, viscosity, hydrostatic pressure, and turbulence. Buoyancy. Now, any body of any shape, immersed partly or fully in a fluid, will experience an action of net force in the opposite direction of local pressure gradient. So, giving an example that we all have might have encountered entering or immersing in pool at some point of time. Whenever we use the float, or when any object which has air like a ball, we push the ball inside and automatically it is pushed upwards. So this pressure gradient arises from gravity when we push it, and the net force is in the vertical direction opposite to that gravitational force. This force is known as buoyancy. So buoyancy and joint loading. What is the importance of buoyancy? So there is at different level of immersion, the buoyancy plays an important role to unload the joints. So I have mentioned this chart where we will be knowing about the percentage of body weight offloaded when increasing the immersion of depth. So when with the neck immersion, almost 15 pounds of compressive forces is exerted on spine, hip, and knees. So when the person is neck immersed in the pool, so the joints inside the pool are the spine, the hips, the knee. On this, only the weight of the head is exerting pressure. A person immersed at the pubic symphysis level have effectively offloaded 40% of the body weight. So that means that if a person is immersed in the water at the level of pubic symphysis, so it is only 60% of the body weight he is bearing. 40% of the body weight is already offloaded. When further immersion, you see that umbilical level, it is approximately 50% of the body weight here. Also, xiphoid immersion will lead to offload the body weight by 60% or more, depending on whether the xiphoid immersion, whether the arms are up or in the pool, it has a difference in the loading of the joint. Body is suspended or floating in water, essentially counterbalances the downward effect of gravity with the upward force of buoyancy. This effect may be of great therapeutic utility. Again, a level of immersion, to be very precise, I have mentioned this chart that when you immerse to the pelvis, it is 60% of weight bearing on the land. Like if you are immersed to the belly button, only 50% of the weight is compared to the land. If you are 80 kgs and you are immersed in the water at the belly button level, umbilical level, you are just 40 kgs. Now, mid-ribs, you will be 40% compared to the land. To the shoulder, it is just 20 to 30% of the total body weight. And to the neck, it is just 10% of the body weight. And here you note that full immersion is roughly zero. When a person is fully immersed in the water, there is no weight at all exerting on any of the joints. If there is a loss of respiratory function, I have mentioned this to make a note that whenever there is a loss of respiratory function or the respiration, the muscles of respiration are impaired, do not immerse deeper than the belly button, because it will be increasing the pressure on the chest wall and the respiratory muscles. So we have to take care that this immersion is not suitable for the person who are having respiratory impairment or respiratory loss of respiratory function. Viscosity. Coming to this, viscosity is the resistance of the liquid. Different liquid have different viscosity. Water has different viscosity than honey. And viscosity of water has a resistance weight, particularly when directed downward to the buoyancy. When I mentioned that buoyancy is having a upward direction force, upward thrust. So the viscosity of water, when you push the arm down, it will give you some resistance. So this is known as viscosity. The low viscosity of water also allows the freedom of movement. If you compare the honey, it has thickness is more and the water is not that thick. So whenever you do a movement in water, it will be free, it will be easy. as compared to you do any movement in honey or any other more denser or viscous material. So combination of these two, that resistance and freedom of movement, combination of these two can not be found in any other environment for exercises. This is a very good benefit of aquatic environment. We do the strengthening without straining the joint. There won't be any load on the joints, and we can do the movement easily, and we can strengthen. So hydrostatic pressure, fluid pressure exerted equally on the surface of water. You can see in the image that when the person is immersed in the pool, there is a fluid pressure exerted on all the parts of the body. Here, hydrostatic pressure exerted is actually increased with the depth of the and the density of the fluid. What are the benefits now? It helps to return the blood to the heart, more effective with less pressure on the cardiovascular system. Without putting any pressure on the cardiovascular system, we help to return the blood and more efficiently. So it decreases swelling of the distal extremities, improves proprioception and coordination through increased sensory input. Turbulence. Now, water in motion always produces turbulent, irregular with eddies flow condition. So whenever there is a flow of water in unidirectional, it produces turbulence. This eddy water moves faster in the surrounding area, and this produces a drag. This drag forces increases by the velocity. If you do turbulence in any direction, if you there is a flow of water in one direction and the speed of the water is increased, then the drag force is also increased. This can be used both in assisting an exercise or resisting an exercise. If you want to do a movement like extension of the elbow, so extension of the elbow, if you give the turbulence from in the direction of the extension, then it will be assisting the elbow extension. But if you want to resist this, you will give turbulence opposite direction of the elbow. Then these drag forces will be resisting, so that can be used for strengthening. So this property of water can be used both in assistance and resisting the exercises. So the benefits of turbulence is it has a massaging effects which reduces pain. It provides varying level of resistance and can be used for perturbation, improving stability and training. When the person is immersed in water, turbulence can be applied from all the directions so that there is a perturbation given to the patient and the patient adjusts himself against the turbulent force. Overall benefits of water we'll talk about, and this is the list which I'll be going into details. Decreased tone, increased range of motion, pain relief, improves proprioception, improves strength, improves and accelerates endurance capacity, improves functional mobility. Now, how does it decreases tone? So the tone, immersion of water decreases weight bearing. So we all know that when there is more weight bearing, there is increased tone of the muscle. Decreased gravitational loading has noted to decrease the tone. The constant movement of liquid environment combined with specific aquatic therapy techniques causes gentle stimulation to the vestibular system, and gentle increase of vestibular system causes the decrease in the muscle tone. Now, this especially is true in aquatic therapy technique that incorporates rhythmical repeated movements of trunk rotation. So whenever in cases of Parkinson, we want to decrease the tone and let the stiff body relax, we use this the technique, aquatic therapy technique, and the tone is reduced. So neutral warmth of water, as I mentioned that this aquatic therapy pool, advanced aquatic therapy pool is not just another pool. You have to have proper parameters of the pool. So one of the important parameters of the pool is it should be a heated pool. It's not a normal pool. So neutral warmth of the water aids in decreasing the tone. The warmth of the water may inhibit the gamma motor firing and thereby reduces the afferent firing from the muscle spindle. Now, how does water increases range of motion? Water increases both passive range of motion and active range of motion. This is because injuries are often accompanied by swelling, inflammation, increased tone, and decreased use that lead to connective tissue restriction, that is stiffness. So when muscle tone decreases, the stretching and soft tissue mobilization techniques are more effective in patient to gain more mobility. Now, coming to the neutral warmth of the water, it increases the soft tissue extensibility. As we all know that thermotherapy has a lot of benefits in increasing the extensibility of the soft tissue. So warmth of the water, it helps to increase the extensibility, plus the specific aquatic joint and soft tissue mobilization. There is joint mobilization and soft tissue mobilization in aquatic therapy by various techniques. So That can be a totally different topic of a webinar where we can include all the different types of techniques and skills of aquatic therapy practice. Here I have just included the basic things and a few research and a few videos. To go into the detail, 1 hour is not enough actually. It's a 12-day course for the certification of aquatic therapy. But yeah, 2 days or 3 days workshop can give you basic idea of a pinch of the aquatic therapy techniques and basic introductions. So, where mobilization techniques help the patient to gain more mobility. Active range of motion, it is increased by buoyancy, by how buoyancy will assist the movement towards the surface of the water. At the surface of the water, buoyancy exerts pressure upward direction. Whenever you're doing the movement in the surface, in the direction of the surface of water, buoyancy will assist. And it supports the movement at the parallel to the surface of water. So where there is hydrostatic pressure and buoyancy together combining to support your body part, and it will help you to go have a free flow of movement of free movement in the parallel level of water. So buoyancy, hydrostatic pressure, and viscosity all together helps in increasing the active range of motion is available. Active exercise programs have been shown to increase the range of motion. Decrease pain. The warmth of the water aids in decreasing pain. Again, the warmth of water coupled with specific aquatic therapy techniques helps to decrease tone, thereby decreasing muscle guarding and spasticity. This helps to improve the blood flow to the tissue and further decreasing the pain. There is a basic concept of pain relief in electrotherapy, physiotherapy.
Hello.
So the brain, it interprets the temperature and pressure of the water. The temperature of the water is warm and the hydrostatic pressure, the brain will interpret that first and it will override the pain sensation. So it acts as somatosensory input acts as a pain relieving point. Proprioception, again, buoyancy tends to decrease the proprioceptive input during the static standing secondary to the weight bearing. So actually the buoyancy, when a person is standing in water, it will reduce your proprioceptive input. But when you start doing a movement in the water, affected by viscosity and turbulence, it will increase the somatosensory input and it will lead to have an effect in the patient or the individuals who are immersed to correct their positions, and this is indirectly a proprioceptive input. Therefore, more force is required to move through water through air. As we know, the viscosity point, air has less viscosity than water. So in water, there is more resistive forces to move. So the patient has to exert some force and some effort to move in the water. So it is likely said that somatosensory input increase more by moving through water than moving in air. On the land, if the person walks, it's very easy. But if you walk in water, you will have to, counter exert pressure on the resistance which you feel by the water. So these results in an increase in proprioception. Now, how does aquatic therapy improve strength? There are various types of aquatic equipments, which is noodles, floats, and dumbbells. All these can be used as a resistive thing because, as I told you, that anything lighter than water will be exerted pressure, right? So anything having gravity or now air is not. If you consider a float, it is filled with air. If you push that float inside the water, it won't go inside the water. It will be pushed upwards again. So aquatic strength training, if it is used supplement to the land-based resistance training, it can help address limitations in the mobility, stability, and endurance, thus helping build the maximum strength and power. Unique property of water allow for what may be termed constant functional resistance. Every movement made in the water is resisted. And as the velocity of the movement increases, the resistance increases. So athletic training in the aquatic therapy pool is always, as we do ballistic and plyometrics here, in the water, we ask them to do fast movement and fast exercises. More the speed of the exercises, more will be the resistance. Due to exponential relationship between the velocity of the movement and amount of resistance created by the drag, it becomes clear how aquatic strength training can be highly effective tool in developing the strength, including stabilizers, maximal power, and functional strength. So that's why these days, as I mentioned, that in sports-specific training, aquatic therapy has become a very effective, must and most important. So endurance training, again, this is also important for the sports players, endurance. So water-based exercises is potentially another viable to improve the cardiovascular fitness. 700 times than the density of air water has. So there is a strong evidence that aerobic exercises conducted for 20 to 40 minutes, 3 to 5 days a week, beneficial enhancing the aerobic fitness, walking speed and walking endurance. They have shown that 40 to 50% of resting heart rate can be progressed to 60 to 80% of resting heart rate. So this is a study I've mentioned in this. There was a study done. So this is a basic study that they have, calculated the parameters like, they have documented the parameters of heart rate, walking speed and walking endurance. So reduction in the heart rate, increase in the systolic and diastolic biventricular functions were observed during the acute water immersion and the exercises. Thus, the benefits of water can be utilized for athletic treatments and sports training for respective functions. Improved functional mobility. Now, the aquatic environment allows patients to be successful with functional activities such as transfer and walking earlier than these skills performed on land. So on land, if we consider a neurological patient or bedridden patient, if we ask them to stand, because of their own body weight, because of the pain, because of the stiffness, or because of the less power, they won't be able to stand from supine to sit and stand. It's not easy. But if you see these components or these functional task, if you ask them to do in water, it is very easy because of the physical properties of water. Because the buoyant support of the water, patient can assume upright posture earlier than they can assume this posture on land. Because again, the absence of gravity has a drastic effect. Patient can take greater risk and higher level of activity. I would like to mention one point here. If a person falls in the water, the person is supported by hydrostatic pressure and viscosity. So the person will not fall directly on the floor. The person will fall in the water and there will be a slow movement. Even if the person is losing the balance in water, he will get a lot of time to come in the upright posture and handle his own stable posture. So water is a safer medium as compared to land. On the land, if we ask the person to stand without any support and leave the patient and count, he will still have a fear of fall. The patient might have the same fear that I'll fall and there will be another problem. So in water, this is one advantage, that there is no risk of fall. Support of water provides greater ease for handling the patient. As a therapist, the water is always very beneficial to handle the patient, because the patient is very lightweight in the water when immersed and the therapist can easily handle the patient. So correct water depth is important for each patient at each stage of this rehabilitation. So temperature, as I mentioned, is an important part. So temperature, the old researchers said that aerobic conditioning can be done in 26 to 29 degrees centigrade. To reduce the spasticity, they use the temperature 33 to 37. So, but recent advances between 30 to 32 degrees centigrade, any of these activities can be done, which includes not only the aerobic conditioning, but also the spasticity management. But warmer the water, more is the relaxation. So spasticity can be done and the temperature can be taken up to 35 degrees centigrade. The pool where I was working in Beijing, it had a control between 30 to 35 degrees centigrade. And cooler temperature, yes, we can take them to 26 to 28 degrees for the athletic or aerobic training. Uses. Now, uses of aquatic therapy. As a result of properties and benefits mentioned above, the aquatic therapy lessens the impact on joints. It provides natural environment with just right amount of resistance and significantly improves the joint flexibility. Aquatic therapy is suitable for patients suffering from arthritis, muscle spasm, muscle or bone injury, or any other orthopedic issues. Aquatic therapy improves proprioception with dynamic movements, improves motor control, balance, and coordination, which is an important part of neurological rehabilitation. And let me tell you this, and that's why I put it in red, that swimming skills are not required or mandatory for aquatic therapy. 10-point of Hellevik program itself prepares the patient how to be safe in the water. So there is no mandatory or there is no eligibility criteria that the person should know swimming. Anybody can get into aquatic therapy pool. So I have mentioned some evidences and researches which let's take a quick glance on. Use of aquatic therapy in stroke patients for the management of spasticity. This is a study done in Latvia, and the conclusion of the study in this 30 inpatients rehabilitation, 30 inpatients were taken in the study 1 to 6 months after the first stroke, that is a chronic stroke patient. The age group was 40 to 75 years. The conclusion was adding hydrotherapy to the rehabilitation program can be helpful in decreasing the spasticity and promoting functional independence and motor recovery after stroke. Another study, effects of different frequencies, that what frequency should be given for treatment. So this study was done for in adults with chronic low back pain. So there was a group of 2 days per week and 3 days per week. The conclusion was 8 weeks of aquatic therapy program decreases the level of low back pain and disability, increases the quality of life and improves the health related fitness in adults with chronic low back pain. A dose response greater benefits were seen in exercising 3 days per week as compared to the 2 days per week. Effectiveness of water-based Liu-Zhu. This exercise is a Liu-Zhu exercise is a exercises protocol given in COPD patients on respiratory muscles and skeletal muscles. So this was done. The study was done in China, and the traditional Chinese and Western medicine association, which is a association where I also was associated to do a research and will be publishing soon. The conclusion of this study was water-based Liu-Zhu exercises has beneficial effects on COPD patients. The respiratory muscle strength and peripheral skeletal muscle function. In additional benefits, exerted that endurance of upper limb strength and endurance of lower limb when compared to the land-based exercises. So coming to the research is done in sports fitness or sports training. So these are some 4 or 5 studies which systematic review was done. One was published in the Journal of Yoga and Physiotherapy, Aquatic Research and Education, aquatic exercise compared to the contrast therapy with shallow treadmill. So underwater treadmill is already being practiced since a couple of decades. But now for these sports patients or sports cases, different techniques of aquatic therapy has been. Now, progressive 5-week exercise therapy program leads to significant improvement in knee function. I'll be showing a video of knee function then after this. The conclusion of this systematic review was aquatic therapy is an effective and safe treatment tool in sports rehabilitation. Safe as in you can start early weight bearing because there is no gravitational force, there is no joint loading, allows the player to get back functional training and ultimately to the ground for playing faster. The recovery period is shortened and the performance is efficiently better. Now I'll show you some videos. Is my screen visible? I just want some response because this is the part where usually my screen is visible, right?
Yes.
Yes.
So I'm playing a video now. Is that visible to all? The video.
Yes, sir.
Initial mobility underwater. So he's Johan Lembach, my teacher, my certifier in aquatic therapy. And this patient is a sports team player of Guangzhou team, China. So he had a meniscal injury and ACL tear. So we did this gradual progression. See again, proprioception and stability training in water. That is a wobble board. This is multitasking training. He has to do 2 tasks at the same time. He has to handle the kickboard and the balls on the kickboard. This is agility training. Quick jumps on the counts, and he was trained for agility, that responses on the counts. Here we are doing sports specific training. There is a ball which is sponge ball which can be immersed in water, and that ball is being given to him, and there is a goal post. So he's trying way before he's putting full weight bearing. He started playing already. At this moment, he was not allowed to put full weight on his joint, but we started training him sports specifically. This was one video. We have time to show some more videos. Can I go ahead? Just to introduce a few equipments and is that okay?
Yes, we can.
Here, this is obstacle cross training. What we do on land, we are giving with support obstacle cross training in water. And underwater treadmill, as I mentioned, this is the underwater treadmill, which we can have a proper, there is a camera inside, we can have a look at the gait parameters and then decide that what component is being impaired, and we can work on that. Your balance reaction training. So there is this meta center to play around. I think that you guys can open the question answer session. Here I will show you another case. Just a second. This was the Victoria child, 8 years child. She had a lower limb fracture. You can see that she is not able to walk at all on land. She is not able to put weight on her left, on the right, the injured lower limb. And I'll show another video where after 12 sessions of aquatic therapy, what happened to her was this. She continued for 25 sessions and she is now all okay doing all the activities by herself. This was just after 12 sessions of aquatic therapy. Here you can see another video I would like to see. This is a patient, stroke patient. You can see the clarity of water. This is an aquatic therapy suitable tool to treatment. You have a stepper inside, you have a wheelchair inside, you have a bobble board. The patient is not able to walk. Okay, and after sessions and multiple number of sessions, say around 10, 12 sessions, the patient was walking independently like this. See, the upper limb is still impaired, but he's able to walk. And the most important part is when the patient shows the expression there. Can you see? Look at the face. In the first session where he was scared, he was so much worried that will I be able to walk or no? Look at the independence and the satisfaction he has to walk in the water. So that makes the patient happy, yes. I think that should be enough. I have a lot of videos, so we'll, if I get time, I'll definitely will share the videos and then we can. This is post-op case, also biking. The same, this individual is wearing a brace and he's biking underwater. See. Also ACL case for rehabilitation of knee. Same patient now being trained in land. Anyways, that's all. I'll stop sharing now.
Thank you so much, Dr. Suraj sir. It was a very great session. Dr. Bharti ma'am, are you there? Yes, Dr. Bharti ma'am wants to share her thoughts regarding this webinar.
Can you hear me?
Yes, ma'am.
Dr. Suraj, excellent webinar, eye-opener webinar, and I think you have given a crystal clear view to all the audience, and you have created a really end-to-end just to learn new things apart from our practice. And you've explained in short so many things, and you have, started a urge to learn more. So maybe in future we are going to arrange a detailed webinar on this topics, and I hope everyone had enjoyed learning new sessions. So congratulations, team. I really enjoyed the session, and it was really well explained by Dr. Suraj. Good going, Team Thane, and wanted to appreciate your efforts. So thank you. Over to you.
Do you have any questions? I think someone has put question.
We would be delighted to have your questions and suggestions. We have some questions right now, sir. So first question is how to go about the treatment of attacks, especially the gait training. And after reaching a normal gait in water, does it reciprocate on the same way on the land?
Okay. So, as I mentioned a slide that neurological impairments has a great benefit about treating the patient in aquatic therapy. Ataxic patient actually, again, the same functional impairment comes into picture that there is no balance and proprioception, and also in these cases we need to see that what components are affected. And on land, these ataxic cases have fear of fall, and water becomes a safe environment for these cases to be treated. So in ataxia, we have to first evaluate the patient in detail on land, take the patient into water. There's a specific assessment tool in water, and we have to patients in the months, give them the perception training and balance training, including incorporating all the physical property, hydrostatic pressure and turbulence. And again, you start evaluating the same patient after n number of, say, assuming that 8 to 10 number of minimum sessions, and take the patient on land and evaluate again. After the assessment, you will find there is a definitely there is a change. A number of researchers have already shown in ataxia. I also would like to mention about my study done in stroke patients, which had the patient have balance issues, and we took the BBS before the session, pre and post. So just in 5 sessions, we had a drastic change of 8 points on BBS. So definitely ataxic patient can be taken, and the improvement reflects on the land. Of course, it reflects. You have to. That's why we have to keep a track of proper outcome measure and evaluation, both on land and water. And when it starts showing improvement, then you have to see. We cannot take the patient for in the water forever. Ultimately, the patient has to go on land and walk. So you start activation, you start strengthening, and then you allow the patient to functionally get trained on land. So it is an adjunct to the rehabilitation, but it is an effective adjunct. So when you incorporate the aquatic therapy, you will definitely see the results and the benefits on land. Yes.
So another question is, in what all conditions hydrotherapy can be used?
I had a slide on that in all the conditions where there is no absolute contraindications, orthopedic condition, neurological condition. Also, we had a special program for pregnant and post-pregnant ladies which had back pain, and also due to pregnancy, a lot of postural, malalignments and stiffness and joint pains are there. So these cases can also be treated. So there is a very big list of conditions which can be treated in aquatic therapies.
So one more question, what all precautions should be taken during pandemic time like COVID-19 when giving aquatic therapy?
Yeah, it's a good question, because last 2 years, because of pandemic, aquatic therapy practice was, going through a very big challenge. But globally, they have made a few guidelines doing studies. So European standards we follow, and Australian guidelines. So they have did this study, and they have set some precaution list that you have to wear a mask and with the distance. But whatever possible things now, if you are taking a patient inside the pool, you have to first make sure the patient is not infected by any respiratory condition. So that is one of the most important point to be taken care. Then again, if at all the patient was COVID positive, we cannot deny the patient to take in water, because we have seen the effects of aquatic therapy in COPD, which is a resemblance of COVID. So in respiratory function, aquatic therapy training is having a huge benefit. So we can just make a point that the patient is 2 weeks past or 21 days past the COVID infection and now having no symptoms or signs of COVID, and then we can take, wearing a mask is convenient for the therapist, which will prevent both patient and therapist from any of the possible infections.
Thank you so much, sir. We are time bound, so we need to stop the question answer sessions right now. Maybe sir will be guiding you after in his further sessions. Okay. Here we come to the end of this event, and now would like to request Dr. Ravi Prakash Singh, EC member of Thane district team, to give a vote of thanks. Ravi sir.
Thank you so much, Dr. Pratiksha. I would like to extend a vote of thanks to Dr. Suraj Shukla sir for sharing his valuable knowledge with us. And I would like to thank him on behalf of IIP team. I would like to thank Central IIP team also, because of Central IIP team only, they are providing us a wonderful platform where the renowned speakers from across country, they are coming up and sharing up their knowledge, and we all are getting benefited from that. And it was kind of opportunity for us, each one of us, to hear it from Dr. Shukla sir. And I would like to thank our digital IIP team, Dr. Nagraj sir, and special thanks to all the participants. I hope you all have been benefited with such knowledge. And I always believe that wherever you get the opportunity you are learning something new, and you should always take the grasp from both the hands. And thanks a lot, IIP team and Thane IIP team, for organizing such a wonderful webinar. And special thanks to Dr. Suraj for taking out time and sharing your valuable knowledge. Thank you so much.
Thank you all for attending this webinar. We encourage you to connect with us for next upcoming events organized by IIP Maharashtra State Thane District team. Thank you.
We'll end the meeting.
Yeah, thank you all. We will end the meeting.